Hi, Medicare Dana here. In this video, I am going to go over how to either enroll in your prescription drug plan or look and see what your options are by putting your medications into the Medicare.gov portal. So I'm going to go ahead and share my screen, and we are going to go to Medicare.gov. And this is a homepage now. Now, just something to know, they change the homepage often. Sometimes they even change where the information is located. So once you get onto Medicare.gov, you want to find where it says Find Health and Drug Plans and click that. This page here, you can either choose login or create an account or continue without logging in. If you know your account information and you've already created an account, then you absolutely should hit this login and put your information in. This will pull actually all the information that you have, your medications that are already in the system. It's kind of a quicker shortcut. But if you don't have your login information, the credentials, or you don't have a login, no worries. Click Continue without logging in. Here you want to click the third button down, Drug Plan, Part D. And then you want to put in your zip code. I am in Austin, Texas, so I'll put that in. And your county will come up. If you have multiple county options where you live, it will ask you to choose which one, and you would just check it by, just like we did up here with the drug plan, clicking that little circle. Now, if you have any of these help from these programs, you would obviously want to answer truthfully here. I'm going to click I don't get help from these programs. And if you don't get help from these programs, you should click that too. Then go ahead to next. You're going to say, yes, we want to compare plans. And we're going to look at both the retail and the mail order pharmacy. So click both and then press next. Here is where you can put in all of your medications. You do want to make sure that you have the accurate name, the dosage, and the amount of times you take the medication, because that's going to influence the drug plan and formulary that you get. So if we put in here Synthroid, we'll start writing it, and it should start popping up your options. Synthroid is a popular medication that many people are on. Click Add Drug. Now they're going to have this little pop-up that lets you know there's a generic available. Some people can take generic, some people cannot. If you can take generic, it's probably going to be less expensive, so we're going to say Add Generic. Here's where it asks you your dosage amount. We're going to say that we take 100 grams. It's 1 a day, so that would be 30 a month here. And then we're going to click Add to our drug list. Oops. Add to our drug list. Now, you click this white Find and Add Drug button. This is where you're going to add more medications. And here's the medication that many people are on. But if you see, there's multiple options, and you see I kind of misspelled it, but it still popped up for me. And I wanted to show you that it helps you. So you don't have to know exactly how to spell it, but know similar and it'll pop it up for you. Here we're going to do the succinate versus the tartrate. And we're going to add in the dosage, 50 milligrams, 1 a day, and say add to my drug list. Now for this exercise, we're just going to have those 2 medications and continue on. So I'm going to push done adding drugs. This is going to take us now to an opportunity to choose our pharmacies. I like to expand my distance so that I have more options available to me. It is important that you're flexible with your pharmacy, because what is about to happen is that Medicare.gov is going to spit out to us all the different Part D prescription drug plan options. And each drug plan has what's called a formulary. A formulary is a list of medications that they cover. And some of them are going to have formularies that are more cost effective for higher tier drugs and some for lower tiered. Now, medications are divided into levels of tier 1 through tier 6 drugs. And typically, the higher the tier of a medication, the more expensive it is. So the idea with the prescription drug plan, similar to original Medicare and a supplement, is that it's customizable to whatever you need, whatever medications you're taking. We want to put you on a prescription drug plan that's going to have the best cost for your medications. If you have a lot of tier 4 medications, you're going to want to be on a plan that has really good copays for that tier 4 medication. So the pharmacies on these plans, each plan has what's called a preferred pharmacy, a standard pharmacy, and some are out of network. The preferred pharmacy is where you're going to get the least amount of copay cost. And because we don't know exactly which pharmacies are on which plans, we want to put a wide variety out there so that we can see. And I don't like anyone to be too tied to a pharmacy because you might be able to save $20, $30, $40, $50 by just switching your pharmacy. So you want to look into that. Here we're going to have CVS as an option, H-E-B, which is our grocery store in Texas, Walgreens, and let's see, we'll go to the next page. Walmart, typically, here's a Walmart. And we have mail ordering as one of the options as well. You can always take that off and add another pharmacy and then add it back in, but we'll do these for now. And when you click next or done, it's going to spit out all of your options. And up here in the right-hand corner, upper right-hand corner, you'll see it says that plans are sorted by the lowest drug and premium cost. So they're taking the monthly premium with what would be your out-of-pocket, which on this one is $80. And with those two medications, this is the prescription drug plan that they're recommending as the lowest out-of-pocket cost. So then I would have you click the plan details. And in this, it's going to show me what their formulary is, which is right here. So preferred generic medications have zero copay on this plan. Generic have a $19 copay, and so on and so forth. Then we're going to scroll down and see the pharmacies. So this is what I was just telling you, how there's preferred, there's standard, and there's out of network. So Walgreens on this prescription drug plan is out of network. But CVS is preferred, H-E-B is preferred, and you can scroll down and we'll see exactly how much it would cost. So at CVS, which is a preferred pharmacy, the copays are $0. If we scroll down, I just want to show you H-E-B is saying the same, but Walgreens was out of network. And if we went there, wow, we would be paying $48 for the exact same medication that you can get at CVS or H-E-B for $0. So very important that you look through this. Now, these two drugs are tier 1, I believe, and I'm going to scroll all the way down to the bottom of this plan details to show you where you can find this information. So here it shows you the tier of the drug. These are tier 1 drugs. There's also these other columns, prior authorization, quantity limits, step therapy. If that's checked for the prior authorization, that would mean that it's a medication that you would have to get your doctor's authorization. Quantity limits means that you would have to have, it would be capped, this medication, at a certain amount. So maybe you can only get 90 pills or 60 pills, whatever it might be. Step therapy means that in order to get this medication, you had to have tried other medications prior in order to get it, but that's required. So that's important to know. If you scroll down further, you can see the quantities that we put in, and there's the brand versus generic. So we will go back up here. And the other thing I want to show you that sometimes confuses people is the deductible. So here with CVS, it's going to say you won't meet your $445 deductible. Some prescription drug plans have a deductible that you have to meet and some don't. And a lot of times, or most of the time, that's based on the tier of medications that you have. So tier 1 and 2 medications, a lot of times they waive this deductible. You can tell that when you look back up at the list of medications, it's showing you the retail cost, the cost before deductible, and the cost after. See how they're the same? That's showing you that that deductible is waived. So if this is the plan that we want to enroll in, you just click this green enroll button and you click join the plan. Here, you're going to need your Medicare number, and there's different reasons why you're joining. You're either new to Medicare. A lot of times it's during your AEP, and this page is going to change a little bit. You then go through all of these steps. It's very explanatory. I can't go through it with you completely because I don't have a Medicare card number, but I wanted to show you how to enroll, how to look at your options. Now, one thing if we go back is that here we just looked at that first plan that they offered. If you scroll down, you'll see each next plan. This is the monthly premium. Here is your out-of-pocket cost, and you can look at the details and continue scrolling down. If you made an error or you realized you put a wrong medication in, up here, click Edit Your Drugs and Pharmacies. You can either edit the drug by clicking this Edit Drug, remove the drug completely, add more, and just click Done. You're back. It takes you back here to this pharmacy page. Click Done again, and it will spit them back out. So that is your little tutorial on how to either enroll in a prescription drug plan or just review what your options are for the plans of choice, the different costs and whatnot. What's important, you don't want to forget, is to have all of your information handy, the name of the drugs, how many pills you take, the dosage amount. There are more informational videos on the website. If you have any questions, feel free to call, send an email. We are happy to help you. MedicareDana.com. Thanks.